having a any kind of connection or relationship with users or customers. And so one of the themes that I'm noticing is that there's a strong theme about there's a couple of folks actually mentioned that maybe you haven't you're collecting data that or that's not necessarily going to be used right there. No clear purpose with inconsistencies everywhere, no ownership. So with that, I'd like, because we're modeling human-centered design here, I was wondering if anyone, maybe 2 or 3 people, if you would be interested in coming off mute and then sharing which of those responses resonated with you the most and why. It could be your own response or it could be someone else's. It could be based on an experience that you've had. Which of those resonated most with you? Anyone willing to?
Looks like we have someone with their hand raised. Crystal?
Oh, Crystal. Sorry, Crystal. Yep, go ahead.
Hi. Yeah, many of the ones that I submitted and the ones I resonate with are all around the theme of being difficult to navigate. So the data's there, but it's hard to tell exactly what's there because there are no clear definitions. That impacts not just the people trying to use it, but the people putting it into the system if they aren't all on the same page about what something means, or trying to guess what something means based on like PTADDRS or some of, you're like, is that the patient address? Can I assume that? And it just gets really too many assumptions being made.
Great. Anyone else? Any other thoughts about what sort of resonated with you most, or what an experience that you've had with data systems that you've had to engage with? Okay, well, I am going to kind of go back now to the presentation and share my screen with that. And one of the things I want to right away say that if you happen to nod off during my presentation, if you get a little bit bored or you decide you want to do some other tasks, I'm going to just give you the key takeaways or one of the key takeaways right away. Am I sharing my screen? Am I not?
No.
Okay, sorry.
No,
I'm going to give you one key takeaway right away. The first is that modernizing data systems isn't just a technical challenge or a technical issue. It's about people. It's about communities, which is a theme that I heard all morning long today. And it's also about the outcomes that we want to achieve. So every decision that we make about the design, about governance, about operations affects who benefits and then who may be left out. And so this is exactly where human-centered design comes in. It helps us step back and ask, are we designing for people using the system, or the people affected by it? So sometimes we design for ourselves not necessarily even the people who are sort of who may be using the systems or the people who are impacted by those particular systems. We design for our own needs rather than for our quote unquote customers, users, or community. So keep that perspective in mind as we go along today in this presentation. Modernization shouldn't just be about what is faster or what is prettier in terms of our systems. It should also be about the communities and the people that we're serving. And that really should be what's driving the work that we do in terms of designing systems. Okay, so I wanted to do a little bit of level setting because I've noticed that when we talk about data modernization, not everyone understands sort of the depth and breadth and the scope of it. Often we do kind of focus on the technical part of data modernization. We focus on maybe the infrastructure of it, the physical infrastructure without some of the other pieces. So here's what I'm defining as data modernization, not just me, but the readings and so forth. Data modernization is the ongoing process of improving how data is collected, managed, shared, and used so it better supports decisions, adapts to changing needs, and works for the people who rely on it. So in practice, data modernization means updating the systems, the tools, and the infrastructure, improving the data flows across the data lifecycle, strengthening governance, privacy, and security, and designing data processes that are usable, trustworthy, and responsive. So at the end of the day, again, data modernization is about aligning the technology, the process, and the people that we're hoping to better serve the communities and the staff who work with that data every day. And so our goals really is about making sure we're clear, it's trustworthy, it's efficient, it's adaptable, and they can really take action and use it. Okay. Yes. So often when we think about data systems or when we're thinking about our current data systems, we're really making sure that we're designing them to be efficient. And we're maybe focused on compliance, what we need to have in order to meet certain requirements. And we are also developing data systems and processes for making sure that they're standardized. And then we're always really thinking about keeping on schedule, making sure that we're meeting reporting timelines, those kinds of things. And while those things really matter, efficiency alone doesn't really tell the whole story about how data serves people and communities. And so I think that those things are very important. We should definitely be thinking about that, but we need to kind of widen our scope of this kind of work. So I am going to again invite you to go back to Menti, and I'd like you to share who you believe our current systems are working well for. What are you seeing in how they are working today? And then we'll take a few minutes to share. But let me go back into Menti so we could see what folks are saying. Let's see what you're saying so far. Okay. So the question again was, what are you seeing in your work today, in terms of what, how are current systems working, and who are they working for, really? That's the question. Who are they best serving? And let me make my screen bigger. So I see that a lot of focus on data experts, government. Yep, largest communities. We've got researchers, often sort of the focus. Let's see, not sure how to answer that given the current systems are missing, needed updating, or elements are in not operable, interoperable. Let's see. Weird populations, meaning white, educated, industrial, rich, and yep. Whoever owns the data. Lots of focus on not really I don't see here a lot about the communities who may be most impacted or who may be using these systems. So some familiar themes, as I said earlier, is that sometimes we have data that's out there, but we are collecting data that's really for ourselves. It's not really necessarily for the community. And on the user side, some of the things that might be showing up with who those systems are working best for is that there may be some frustration by the community. There may be, the data doesn't necessarily match what's happening in reality. And so those are some issues that will also show up when you see there's a incongruence between who the systems are working best for or working well for versus who might be really the focus of the systems. And if anyone wants to come off of mute and share any thoughts that they have about this, any maybe strong feelings about this, certainly you're welcome to at this time.
Hello. Hello, can you guys hear me?
Yep, we can. Go ahead.
This is Abe Saleh from the Wayne County Health Department in Michigan, and I wanted to just address that question in particular. I feel that it is often that people who are represented in most of those studies, research, as well as surveys and all of that, it seems like there's a lot of people who have access to these tools, people who actually can participate in these. We know for sure, and we see that often in public health, that there's a lack of equity and access in tools and access in technology, for example, and things of that kind. So those people who are being represented in these surveys, data that is being collected might not necessarily be representative of the population that the populations that we are serving. So it's quite important that we need to keep that in mind as we are looking into design and interventions and analyzing the current data sets that we have, that they are not true representation of those who are, most in need, for example, or those who might need to be um, um, whose problems might need further look into, and so on. So I think that's one thing that I learned in public health for sure. That not everybody, unfortunately, has the opportunity and chance to express themselves as well as tell their story and their talk about their problems. Thank you.
Thank you. Absolutely. That's a really important point around the process of data collection that we often don't realize that not everyone has maybe the tools, the technology to be able to respond, or they might not have the way that we develop certain we were talking about surveys earlier, the way that surveys are written, and the types of the way that even how we develop the logic of a survey might not work well for certain communities. And sometimes we focus only on collecting data that is quantitative versus in a quantitative way, because it is sometimes the most efficient way, or it's just the easiest way to get this to collect that data. But we might have to really stretch a little bit and think about other ways of collecting data if we really want to get a full view of everyone in the community beyond those who are fitting that weird category. So I'm just going to go back to the slides, and I was just thinking, if you think back to when I asked that question first early on about the worst case design, the worst design case that you could develop. A lot of the responses really focus on process and decisions that are made around who gets to be involved in that process. It really didn't talk much about technology. You didn't talk about some of the tech things that are involved in modern or data modernization. It's really ultimately about the people, and so that's where human-centered design really comes in. And it's where a human-centered design lens really matters. So human-centered design uses a structured way to keep people visible as we modernize systems, and not just in the beginning of that process, but throughout the process. It shifts the thinking away from what data are we collecting to what do we need to know about the community, what decisions need to be made, and how do we act on them. And then it really focuses on improving data quality at the point of collection, and right away at the point of collection, but it also has that thread throughout the entire process. And then it reduces work, all of the rework that we might have to engage in downstream. It increases trust and participation, and then it produces more actionable insights as a result. So human-centered design and data modernization are not separate activities, but they sound like they're totally separate. And why would you even bring these two together? But they're really not. As public health practitioners and data systems professionals, our goal is to be intentional about the decisions that we make and how those decisions shape the things that we design. Every design choice creates a specific experience, and those experiences are felt most directly by the people that are using the system. It's not always our direct public, but it's those folks that who may interface with the public, and it has to work for those sort of intermediate folks as well. So every design choice really must be directly, must consider the people who are collecting the data, the people who use the data, and also the people who are reflected in the data. So if human-centered design is new, is a new concept to you, and I'm sure it isn't, that you must have heard it, or maybe you're you're pretty familiar with human-centered design. I thought it might be helpful to just still give an example or give some refresh what it is and what it is not. So human-centered design is, again, person first. It's created with the persons, the users, the community in mind. It's evidence-based. It's empathetic. It's meaning that you feel with the people. It's made to be simplified. We optimize it for human interaction. It's focused on problem solving, and we make sure that it's accessible and inclusive. And then it's meant to be coherent across all systems or across different systems. It is not solution first. So we don't create for the person. We create with the person. It is not assumption based. It's meant to be sympathetic, not sympathetic, but in the fact that we're feeling for them, we're feeling with them instead. And we really try to make it uncomplicated. It's not about enhancing or adding new features or requirements. It's not about making things pretty. It's not a one size fits all. And it's not meant to be system specific. So whether you're using an agile or a waterfall sort of framework, or you're used to that, or you're just gathering requirements or doing some kind of technical discovery, or doing process improvement, human-centered design adds really useful ways of thinking and working that can fit right into those frameworks already. So that's my second key message. Employing human-centered design methods will help you better problem solve because you're listening and learning from the people who are using the systems firsthand and who are also experiencing the problems firsthand. Okay, so I've talked a little bit about human-centered design as the approach already, and I've talked also about data modernization in terms of the work. And I'm now going to add another component because this is my sort of area of work as I work in data equity in our agency. And I I wanted to just add just this one more component that would help guide some of this work. CDC's CDC Foundation's 5 guiding principles to embed equitable practices throughout the data life cycle provides us with a map for designing and modernizing data systems with a variety or all types of communities and people in mind. So together, these two parts, the human-centered design and the guiding principles, the 5 guiding principles, help shape how systems can be planned, how they can be built, and governed, and improved, and not just focus on how we maybe collect or analyze data. So I am going to walk through each of the principles, and I'd invite you to consider 2 things: whether where you already see this showing up in your practice, and where you might want to do a little bit of stretching or pushing yourself to beyond what you're currently doing. So the first principle is to recognize and define systemic factors as well. So those are social and economic factors that shape health outcomes and communities' abilities to thrive. And then our second principle is really reminding us that language and action are part of the continual learning process. The third principle is focusing on proactively including people from communities of interest in the research and program design process. And the fourth principle emphasizes collaboration across agencies with communities with the goal of creating a shared development agenda, data development agenda. And the fifth principle is about data sovereignty, creating conditions where communities can govern the collection, the ownership, the use, and the sharing of their own data. Okay, so before we move on, I wanted to pause, not necessarily to evaluate these guiding principles, but just to notice what surfaced for you. And I'd like you to take a minute to think about one data system, a data set, or a reporting process that you're currently working with. And think about which of the 5 CDC Foundation guiding principles are, sort of resonating with you. And then what is it nudging you to do? And you can go ahead and put your thoughts in Menti. And we'll give you a minute or so. And just remember, there are no wrong answers. And we're just sort of thinking, or I'm just sort of wanting to see what stuck with you and what is it kind of quietly asking you to do differently in your work. And you don't need to think about all the guiding principles at the same time. You can just focus on 1 or 2. And I'm going to stop sharing this screen and then go back to the Menti. Some really good thoughts, focusing on cultural modification, really showing up quite a bit here, really resonating with folks. Question about could it apply also to people with disabilities and neurodivergence? Absolutely. How can we respect data sovereignty while keeping data systems standardized or interoperable? Great question. Good thing to think about. Yep, cultural modification really a key concern here. Is there anyone who would be willing to come off mute and maybe talk about what your what you either use what you responded, how you responded, or what you're seeing from some of the other responses? Are you surprised? Are you familiar with these guiding principles at all? And I did at the end of the slide deck, I do have a link to that document, and it was pre the current administration. But it's difficult now in this climate to focus on equity, and we have to sort of couch our language in different terms, and thinking about so I don't even talk about equity. I really talk about community, and we're talking about everyone. We're not just talking about certain communities. We're talking about everyone in the community, and often one of the things that I think about, and I use this example in my work for things like making sure that we're addressing everyone's needs. When for folks with any kind of mobility issues, when they started redesigning sidewalks, they created cutouts so that folks who were in wheelchairs or needed to be able to step off easily off of a sidewalk, that they could be able to do that. And I use that as an example in my work with data equity, in that it really isn't just for certain communities, it's really for everyone. These changes, these ways of doing work really ends up benefiting all communities and not just certain communities. Okay, so since I don't hear anyone else, any other discussion, I will move on, and we'll move back to the slide presentation. Okay, so now that we've looked at the 5 principles and reflected on how they show up in systems and that we work with, I'm going to shift a little bit to how we could put them into action. And so I'm going to circle back to human-centered design, because it gives us a structured way to do that through a very specific set of phases. They really are helpful because they guide us from understanding the people and the problems that we're designing for, all the way to how we might test and iterate the solutions that come up. And we can think about these phases, how they can integrate the principles and really make them come alive in our work. So human-centered design is a mindset and it's also a process. The mindset is centered around empathy. It's keeping people at the center of change. And the process includes empathize, which is understanding and really listening to people. Define, which is about framing the problem clearly. Ideate, which is generating creative options and possible solutions. Prototype, which is testing small and low risk versions of those ideas. And then testing and iterating, which is refining those the best ideas based on feedback from those who are involved in the process and potential users or community folks. And I'm just giving a very high level overview of human-centered design because there's lots and lots of training on human-centered design, but I just wanted to give a high-level overview, and then we'll kind of bring those two pieces together. So here's a little bit more clarity on the relationship that I've sort of pulled together between human-centered design and the CDC Foundation's principles. So human-centered design gives us the approach, and the CDC Foundation principles provides a guide on how we can apply it responsibly, especially with respect to data modernization, which is the work. And so human-centered design, again, gives us a structured way to engage with people through clear phases. And the CDC Foundation principles tell us to apply those, how to apply those responsibly. And they really focus that area focuses on accounting for context, history, and systemic conditions at every step. And so the first principle is all about recognizing and defining context. This means understanding the systemic, social, and economic factors that affect health before we jump into redesigning the system. And in a human-centered design action that you would take is really focusing on observing and mapping a real-world context before you design the modern or start modernizing systems. And the data modernization work that would be involved would be really investigating historical policies, what are systemic barriers and past harms that communities or users have experienced, analyzing what the local conditions may be, and then conducting interviews with it may include conducting interviews with program staff and community representatives before you're redesigning forms or creating new process or whatnot. So a good sort of prompt question would be, what assumptions are we making about how the system is working, and whose reality might those assumptions be missing? Okay, so once we've taken time to understand context, the next principle asks us to stay open to learning. It reminds us that the language that we use and the actions that we take should evolve as long and look closely at the data as we challenge our own assumptions. If we were to take a human-centered design action, it would mean engaging a range of expertise when we analyze and interpret data. And in a data modernization context, it would show up in really concrete ways. It would mean including a variety of expertise in program staff, data scientists, as well as community perspectives. And they would be giving input into interpretation, disaggregating data to better understand differences across race, geography, and socioeconomic status, and really resisting this concept of creating so that it's one size fits all, which is sometimes a default that we tend to go to. A prompt question would be who defines expertise and who might we be overlooking. So before you sort of jump into your work, to really think about who is involved in terms of their expertise. It's not always those with sort of formal, what we would consider formal expertise. And principle 3 is as we move from learning and interpretation, we go into this next step about analyzing the people beyond just analyzing them to designing with them. And so this principle centers the involvement of community members in the research, the design, and implementation. In human-centered design, it looks like co-creating tools and analyzing approaches and thinking about the way that data is shared. In terms of data modernization, the actual activity, it might include bringing in community members and staff with lived experience into the process of planning, adapting the data collection to make sure it's culturally responsive, and recognizing that there may be multiple valid perspectives reflected in the data. And so a good prompt question is who needs to be involved in this design work? And where are we currently designing about people instead of with them? So once we've designed with people, the next principle asks us to be intentional about what we ask for and why. Not all data is equally valuable, and I think we kind of heard that in some of the discussions earlier today. And not all data collection comes without a cost. So this principle really focuses on working with agencies and the communities to prioritize what data is collected, accessed, and used. And in human-centered design, that means that we are co-defining the priorities and the design decisions so that the data is relevant and the burden is reasonable. In terms of data modernization work, that shows up by engaging stakeholders to decide what matters most, collecting only what's necessary and what's feasible, and then building a shared agreement around access, use, and interpretation. And a good prompt question for this would be, what are we trying to understand together? Okay, so the final principle brings all of this together and looks beyond design and collection to stewardship. It's asks what it really means for communities to have a say in how their data is being used and governed. From a human-centered design perspective, it means creating the systems and the policies that support ownership, control, and the meaningful use of the data. In terms of data modernization work, it shows up in the governance structures that invite community input on how data is collected, stored, and shared. Um, in most human-centered design models, that lives in the empathize and define phases. But with a sovereignty lens, it goes further than just listening because it's about shared power in the decision making from the very beginning. And that's where most of the weight, this step carries most of the weight. And a good prompt question would be, are we designing for people or with people who hold the decision making power? Okay, I'm just wondering about time. How am I doing on time?
Hey, Elizabeth. Yes, we actually only have 10 minutes or so for questions at this point. So, whenever you're ready.
I'm going to quickly go through this then. So some common data modernization pitfalls that I wanted to quickly review and then offer what might be a human-centered design fix would be that there's an absence of a clear strategy. And what's really happening is that those modernization efforts focus on technology upgrades without really thinking about a shared purpose. A human-centered design response would be to really clarify what the problem is, what the problem that matters most, and for whom and why, and then to translate those into a shared problem statement before just choosing a set of tools and so forth. Another pitfall is continued dependence on existing systems. And that's translating to that legacy systems sometimes feels safer because we're sort of adverse to change and it's, being risky and it's expensive and disruptive. And so we like to kind of hold on to what we know. A human-centered design response might be to start with understanding people's workflows and not the systems themselves, and really understanding where those legacy tools slow decisions, create workarounds, or exclude others. And then I know one of a huge pitfall is really limiting the alignment between, or a limited alignment between IT and the business part of the work. Sometimes that means that teams really optimize different success measures and they are not necessarily sharing the decision and the authority for making decisions. So a human-centered design fix would really be to bring the business side and the IT and the data and all the community perspectives into the same design activities. And that might be, you have to use different tools like journey maps and prototypes and share this scenarios to really get to an understanding of what the problem is and how your different sides are seeing it. And it's too bad because that tends to be a huge issue for many folks. No clear plan for how data should be used is another common pitfall. One of the things that we often do is we collect data just in case we might need it, but we often just have it sitting on a shelf somewhere, which leads to overload and gaps and misuse. And so potential human-centered design fix would be to design backward from the decision that users need to make, and then to test whether those data outputs are understandable, usable, and timely. And I also had thoughts about what guiding principles should be included there, really collecting only what is necessary to answer the high interest questions, and really focusing on supporting community governance over how data is interpreted and applied. So I'm going to wrap up now. We're going to just go back to the Menti, and I'll ask folks to answer the last question, which is, which data modernization pitfall are you seeing in your work? And number one is what we're seeing on the screen right now. Am I sharing my screen? Is that there's continued dependence on existing systems. And then another problem is lack of a clear strategy. And then a lot of folks are saying limited alignment between business and IT priorities. I have an other, and I couldn't, in Menti, you can't, you're not able to have people type in what their other is. And I'm curious to know what is for those who put in the other, what are the others? And you can put those in the chat if you're willing to do that. Okay, so we are over time, and I'm sorry we didn't have much time for questions, but if anyone had any questions that you wanted to ask or any comments that you wanted to make, please do offer those. And then I also asked, the last question was a 1 or 2 word takeaway from this presentation, which is, community first, know and see power structures, very good, and really the importance of planning together. And I see in the chat other that some people were release of information form, lack of trust between departments, lack of leadership will. Any other things anyone wanted to share out loud or even in the chat?
Yeah, does anybody have any questions? You're welcome to add them in the chat or come off mute.
I thought I was talking really fast, but I guess I wasn't talking fast enough.
No, did great. Well, I can ask a quick question then. How can smaller health departments with limited resources apply these principles without overcomplicating their processes?
I think that, some of the work that you can integrate this work in small ways. It really doesn't have to be a huge effort, and I know that that's kind of often a barrier that folks will bring up. But as a part of, I know I heard people talk a lot about assessment processes that you're doing, or if you're we also had the evaluators talked about their using logic models to plan out your programs. It's often a really good idea to even start from the process of using a human-centered design framework before you develop your programs, or developing that logic model, where does your theory of change come from? Is it a good idea to do this particular program, these particular activities? Will it make sense from a community perspective? And so really going to communities, having, if you have meetings with specific groups already, incorporating that process around asking questions, having conversations with them. It doesn't have to be, you know, high level types of things. It could be just having small, intimate conversations and then collecting that data. And then the thing that I've been struggling, or I should say I struggled with when I worked at another organization and we were using human-centered design is the process, is the at the point of prototyping. How do you prototype something? That's where people begin to worry about the cost of doing something or the time involved. And so those are, I frankly am still kind of struggling with how do we get that message across? How do we help people deal with those things? But those first phases of collecting or understanding and empathizing are really um, are not necessarily difficult. You can do things like do focus groups, you can do listening sessions, you can just go out into the community and watch to collect and empathize. And then defining the problem, you can have conversations with them. Um, it's that when you get to the point of really figuring out how you're going to sort of test this, that it becomes a little bit tricky. Oh, it looks
Yes.
like a
Well,
question really, really quick.
no, thank you. Thank you so much for the response. It looks like the breakout sessions are about to close. So I just want to appreciate everybody for joining Elizabeth's presentation. I learned a lot and I always appreciate learning from you. So thank you so much.
Thank you.